Great. Thank you and good morning. Really want to touch on two subjects today. First, we were all very excited to get the green light to move into phase 2 on Friday, and we started to see some businesses opening immediately. We really expect to see more businesses open as they get their protective measures and change in place and make the necessary changes they need to make. So very excited about that, and I know that the general mood around Snohomish County is upbeat about that, and I think people are really grateful to be seeing businesses start to open. So we just urge everybody to be very aware when they go into a business. They should wear face coverings and make social distancing to the maximum extent possible. So we really do not want to see a spike. We have a 3-week monitoring period before we can possibly move into phase 3, which we would very much like to do, but we really need to have those protections still in place, people being cautious, do not want to see a spike, and we're hopeful that if we can keep the numbers low and declining, that we'll be able to move into phase 3 as quickly as possible. Second issue I really wanted to touch on briefly is the murder of George Floyd and our community's response. First of all, I've got to say I'm extremely heartened by all the outpouring of outrage, frankly, and the peaceful marches and protests and events that we've had throughout the county, out here in East County, Monroe, Snohomish, Everett, Linwood, Edmonds. Throughout the county, we've seen really an outpouring of concern and the demand for change in our institutions and in our society. And so I'm very heartened by that. I think we are a caring community, and that has really shown over the last week or two. And but I do want to say I was very concerned about what I saw in Snohomish a week ago with the gathering of many armed citizens. There was, it's unfortunately described by the mayor and the police chief, a festive atmosphere with mostly young men wearing or sporting semi-automatic rifles. There was drinking in the streets. There was burning of rubber car tires, so you can still see the marks in downtown Snohomish. And the whole event was joined by some good-meaning citizens and concerned business owners who had been alerted of the possibility of Antifa attack, which it turns out was bogus and contrived. We had the known presence of white nationalist groups that actually triggered that event and were very present and forefront in our communities. And this concerns me deeply. Vigilante justice is not welcome here in Snohomish County. We have a law enforcement criminal justice system. Our sheriff's deputies are fully capable and trained. Our police departments are capable and trained of controlling situations. We have a court system. We have a jail. We have prosecuting attorneys. We have public defenders. We have a whole system to deal with these types of events and the issues. We do not need citizen vigilante justice to spring up. It was a very dangerous situation. We're very fortunate that it didn't really turn far worse. So as we move forward, we know that we have institutional racism issues to deal with. In many of our institutions, county government is no different than any others. But I'm really hopeful that the recent events with George Floyd's death and others will really trigger some change in our society and our institutions. And I'm talking with community leaders about next steps and things that we really need to put in place. I think we do need to take this renewed focus and energy and make some long-lasting changes in our community, our institutions, our nation, and hopefully our world. And I'm very hopeful that that will happen. So with that, I'm going to turn it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and good morning, everyone. Today I have two topics to focus on. Phase 2, looking toward Phase 3, and a new path forward with respect to the Snohomish Health District's data updates. First, regarding phases 2 and 3, now that we're in phase 2, we've already had questions about what the path to phase 3 looks like. The short answer is we just need to keep doing more of the same, more of what we've been doing already. We, as Executive Summers mentioned, we need to wait at least 3 weeks until we're eligible to apply. Why the 3-week waiting period? Well, as I mentioned before, what happens today in the community with respect to transmission of the virus won't show up in our numbers for 1 to 3 weeks. Why is that? Well, remember that the average incubation period from the time a person is exposed till the time they develop symptoms is about 4 to 6 days on average. It can be as long as 2 weeks. Then there's the time from recognizing one has symptoms to seeking testing. Then the specimen goes to the lab, gets analyzed, the result gets generated. That goes back to the doctor and to the patient, as well as to the health department. And so it's generally, the minimum amount of time from exposure to the health district finding out about a new case is roughly 7 days. So that's a minimum of 1 week, and sometimes it can stretch out to 3 weeks if there's a long incubation period or delays in seeking or obtaining testing. So that's the time allowance that we need to watch and see what our activities are generating in terms of transmission in the community. And remember, even 3 weeks from now is just measuring what's going on in these moments. So during these 3 weeks, we need to maintain the progress we've made so far. Make sure that case counts stay within that 25 cases per 100,000 per 2-week period. That is the threshold that allowed us into phase 2, that hospitals maintain their capacity to take a 20% increase in bed demand due to COVID or other illnesses, and that we're doing enough testing in the community to keep the positivity rate down around 2%. There's nothing magical about that 2% figure. It's just that from communities and countries that have had success in controlling the transmission of COVID while trying to keep their economy and society somewhat more open, you really need to be doing about 50 tests for every case to feel like you're comfortably doing a good job of detecting the vast majority of cases. And the health district continues to work actively toward expanding its availability of testing for folks in the community, while the medical community and healthcare system is continuing its previous efforts. At the health district, we're bringing on additional staff to help us toward achieving the time windows for reaching cases within 24 hours of us being notified, and reaching their contacts within 48 hours of us learning about the original case. And then finally, we're counting on residents and businesses to continue helping us hold the line so that case numbers don't increase while the first increment in economic, social, and recreational activity takes place under phase 2. You can continue to help the cause by wearing cloth face coverings when out of the home, keeping 6 feet of physical distance between you and others when out of the home, practicing thorough and frequent hand hygiene, either with hand washing or with hand sanitizer, following the guidelines for phase 2, and also thinking about others and trying to protect others, especially vulnerable people who are more likely to get sick or need hospitalization if they get infected with the virus. So again, phase 2 is not a return to normal. It's a first step in the right direction. It's conceivable that it could take a little bit longer than 3 weeks for the health district to demonstrate to the Department of Health that it is safe for Snohomish County to move to phase 3, but at the health district, we're fully committed. We know our partners in the county and the rest of government and the healthcare system are on board with us, and we appreciate you, the residents of Snohomish County, likewise working with all of us toward that next step. Moving on to data updates, the Department of Health has made several significant investments and improvements in the time and resources to expand their data dashboards describing the COVID situation. And on their website, they have a statewide dashboard, and you can also select specific counties. This adds a lot of good graphic information to what the health district has already been providing. and really does a good job of updating the community on a daily basis about what's going on with COVID. Given this and our need to focus our data monitoring and analysis on those numbers I was just discussing, those measures of our success in holding the line in phase 2 and being ready to move on to phase 3, we've really got to turn to focus our data analysis efforts on that. So beginning this Friday, that will be our last daily update from an in-house Snohomish Health District case count, and that will then shift to making a link directly to the Department of Health dashboard to access that very same information. So before I turn it over to Jonathan, I do want to share a quick message from the Health District for all the graduates out there. You and your classmates and families have worked for years to get to this moment. We can only imagine the frustration and disappointment that many are feeling in not getting to have a traditional graduation and the celebrations with your family and friends that surround that. Please know that while we can't have the graduation ceremonies that you all deserve, we are incredibly proud of the class of 2020 for stepping up and showing up during this pandemic. And this hardship that you are enduring will make you stronger and better prepared to deal with disappointments and setbacks that you will encounter in the future. The Health District wishes you, your classmates, and your families the very best in your future achievements. Congratulations. Jonathan?
Thank you for that message, and also thank you for having me. So yeah, I'm Jonathan Kwong. I'm a senior at Mountlake Terrace High School. And one of the things as a senior, people usually tell all of us is to make the most of our senior year. And I guess we really took on a new meaning to that this year. So we did most of our typical things in the beginning of the year, like applying for colleges, looking for jobs, searching for apprenticeships. And while we had homecoming and we were working on coordinating concert schedules and field trips for our winter and spring quarter, the school closed, and I think the next 2 to 3 weeks after school closure was the hardest because our district and school administrators were preparing to switch to remote learning, and our teachers were restructuring their curriculums as we students were beginning to realize that all the activities we were looking forward to, like field trips, performances, prom, moving up assemblies, and even graduation, at that time we thought weren't going to happen. And I think for me, I overcame one of the lockdowns easier than some people was because I had a really busy schedule. Because as a STEM student at Mountlake Terrace High, we have to do a senior project on a STEM related topic in order to complete the program. And so 2 weeks before our first virtual science fair, which is CURSEF, the Central Sound Regional Science and Engineering Fair, all schools closed. And then the science fair became a virtual fair where regional science fair merged with the state science fair. And we had to do it all remotely. Overall, it was a really interesting experience because instead of our typical board presentations, we had to present it using slide decks. So it was also playing a lot with technology, playing a lot with how we would present things without being able to give physical models to people. And overall, our school placed very well with 7 projects placing first, and one of those projects qualifying and advancing to the International Science Fair. And it's really nice to see all these achievements even during such hardships. And one of the other reasons I became really busy was I was also the editor-in-chief for our school's yearbook, and the sudden school closure threw our plans totally off course. And in order to get the yearbook up and running again, we had to overcome a lot of technical barriers, reshuffle some content around, reposition the yearbook to cover everything from COVID to virtual classroom to graduation, and somehow make up for the few pictures we have for spring sports. And speaking of graduation, I actually really want to thank everyone from the school district to all the staff and faculties at our school for the amount of work and thought they put into giving us a really memorable graduation, no matter what. So starting from like picking up our cap and gowns, we were allowed to do a drive-through pickup, and all the teachers and staff came out with personally decorated signs and balloons and congratulated us with loud cheers from the sidewalk as we drove off. And it was a really emotional send-off, and all of us really appreciated seeing our teachers one more time as a high school student. And while we usually, as high school and Edmonds School District, have a commencement ceremony at the Edmonds Stadium, this year we got to have our commencement ceremony at our own schools. And actually last Wednesday, we did the recording for our virtual graduation ceremony, and it was one family per car, and each of us drove around the school. So at the back of the school, the counselors passed out graduation cords and cheered us on as we drove to the front of the school, where we arrived at the roundabout, and then the graduate gets off, gets their diploma from the principal, and then we walk onto a stage to get our graduation photo taken. And then once we got back into our cars and drove away from the school, the Parent Boosters Club gave us farewell goodie bags that they put together with local companies. And it was filled with like a class mug, a grad cap cookie, and then a bunch of candy and a face mask. And it was just a really sweet idea for them to put that together. And actually yesterday, I went back to school for the last time to return my Chromebooks, my textbooks, and collect the items we had left in our lockers. And I don't think it really felt like high school was coming to an end until yesterday. But when it was time to return my Chromebook and textbooks, it was a sudden realization like, oh, this is the last time I'm going to go to school as a student. And even so, we're just on the campus around the school. We don't actually get to go into the school building. So it was nice for that. And I'm thankful that our commencement ceremony will be broadcasted online this Saturday at 10 a.m. And we'll all be watching physically distant, but virtually together. So yeah.
Great. Thank you, Jonathan. And from the class of 70 to the class of 20, just wish you all the best and great success and fantastic future. I know you're going to go to the UW. You're planning on going to the UW, and go Huskies. So thank you, Jonathan. And again, congratulations. So got a couple questions. First one is for me. Do you support calls for redistributing half of the sheriff budget to housing, counseling, and social services? Well, I do not support an arbitrary reallocation of dollars. What I do support, and what we actually started on last year, was an examination of our entire criminal justice system. In Snohomish County, currently about 77% of our general fund budget goes to the criminal justice system. When I started on the county council in 1998, it was about 56%. So it's grown over the years to a huge chunk of our budget. And that system includes the sheriff's office, the jail, our court system, prosecuting attorneys, public defenders, the clerk's office, and others. So it is truly a system. And I think what we need to do is have a conversation, further conversation about roles and responsibilities and who does what best. And we've recognized for quite some time that we ask our law enforcement officers to be not only law enforcement officers, but mental health responders and medical responders and family counselors, and are interjected into very complex situations. And frankly, I think we started down the path last year of teaming up social workers with teams with law enforcement professionals out in the field to contact and work with some of our homeless population, get them services, and I think we need to sort of strengthen those efforts. Unfortunately, the reality is, even if the county took its 1% property tax increase, which is about 7 cents on your property tax dollars, 1% of that, we would still be falling behind. So we're really shrinking as a government. We're about 140 people short, lower in number than we were in 2008, and that's going to continue. So we really have a collision of sort of dwindling resources relative to our county size and the roles and responsibilities that people expect us to perform for them. So we'll engage the sheriff's office, the whole criminal justice system, and our county council, who ultimately makes the budget decisions to decide the best way to distribute funds and work together as a team. And I think we need to relook at the team and who is best suited to do what. So it's not a simple 50-50 kind of decision or action that we take. We're going to have to figure this out as a team. Next question is for Dr. Spitters, and is more information from WHO, the World Health Organization, regarding potential risk of people without symptoms to spread COVID. Is that still considered a risk? And also statewide, there's been a larger case number increase in the past 3 days. Anything to be concerned about at this point?
Okay, let's take those one at a time then. I have seen the headline of the WHO. I'm not sure if it's guidance or report that they've found, some countries have found lower transmission rate from asymptomatic individuals through their contact investigations. So first, I'd have to review the actual original WHO document, which I haven't done yet. But I would just, as a broad feature regarding all medical science, there's no single report or guideline or commentary that drives or changes the needle in general. I think we still know from empiric experience that transmission from asymptomatic people does occur. It's certainly less than someone who's coughing and sneezing, but I don't think that this report from WHO is going to change anything in the next few days in how we do things. And the scientific discourse will play out over time, and facts love time and time love facts. So over time, if that finding really holds up across multiple settings, you may see that somehow affect our disease control efforts. But right now, it's just another piece of information on the map about COVID-19 and transmission. Statewide, there's been a larger case number in the past 3 days. Anything to be concerned about? Well, certainly anytime case numbers are increasing, that's going to be a concern because it's a signal of increased transmission potentially. I would encourage you, though, if you do go to that Washington State Department of Health website and look at it and go down to the county level, I think what you'll see is that Snohomish, King and Pierce and in the Puget Sound area are kind of flat, more or less, and a couple of, particularly Yakima County is really in a dire situation right now, and their case counts are increasing. And so some of that is what you're witnessing statewide is a putting together of findings from different settings. So things seem kind of level in Puget Sound and kind of still going up in central Washington and eastern Washington overall as a group. That's not to deflect any blame or concern on them. We're really concerned about what's happening there because we're all one state and people move around, and increased cases in one place can become increased numbers of cases elsewhere, including here, as people move around. But I think that it's premature for us to draw any conclusions about the initial days of phase 2 or even the result of people gathering for the protests at this point. So I would say stay tuned on that. And when you do see a statewide increase or decrease, I encourage you to kind of click around and take a look at the different larger counties in the various regions and see if that helps you sort it out.
Jump to the question for Jonathan. Jonathan, what was your science fair project and how are emotions running with your friends? And after UW, what's next for you?
My science fair project. Okay. My science fair project was titled Testing Effectiveness of Auxin-Augmented Arabidopsis thaliana in Phytoremediation of Floodwater Contaminants. What I essentially looked at was I was looking at using a plant to filter floodwater. And I was adding plant hormone to see if it would, to see the effectiveness of that plant hormone in causing the plant to uptake more contaminants or less contaminants. And I did it in a controlled environment. I built a hydroponic system, which is basically a water garden. And then I looked at three main contaminants that were prevalent, or I found that were prevalent in Washington State, which were arsenic, lead, and phosphate. And yeah, my project got first place and the best in category for the entire state of Washington. So that was nice. But yeah, it was really hectic during that time because I was almost done with all my data collection and I still needed a microscope and a lab table to do a few more experiments. And then it was like 2 days before the school was announced to be closed. And I was like, oh, gotta rush all this. So I remember getting permission to leave a lot of my classes just to spend most of the school day in the chem storage of my school working on the project. So yeah. How are emotions running with my friends? There have been mixed feelings, and we have gotten to points where we were like, oh, this pandemic might go on forever. But I think we've been able to get through this together because we've been able to get more in touch and more often. And so like we've created many group chats with different people. We've created like Discord channels. We've made sure to like FaceTime, Zoom call, Facebook Messenger call a lot of our friends just to like check up on them. And I know a few people would always call me and just to like check up on me, and I do the same. And I think it's just that network we create around each other that really helps all of us get through this together. As for UW, well, I was accepted to the interdisciplinary honors program at UW Seattle, and there I plan to major in biochemistry. And in fact, because of the pandemic, I actually requested and they allowed me to start the summer quarter in 2 weeks. So I'll be starting college 9 days after I officially graduate. But after I graduate from college, I plan to just go for a master's, or long-term goal-wise, I've been really interested in public policy, especially with the school board. I've really gotten an insight into how most of it works, and I really want to continue pursuing that. And I want to focus more on like public policy research, and probably more like public policy research for the environment. So yeah.
Excellent, excellent. Dr. Spitters, there was a question for you. Under phase 2, the county must provide weekly updates on its case investigation. Will those be posted on the health district website?
So we're developing a dashboard similar to the one that the state has around the Safe Start reopening, and we will use the findings from our weekly reporting to populate, to update that dashboard, and that dashboard essentially mirrors the reporting requirements of the phase 2 monitoring. So you will see it in that format, indeed.
Great. And two last questions for you, Dr. Spitters. The state set a deadline of June 12th to offer tests to nursing home residents and staff. Will the county meet that deadline? And also on Monday, the state secretary of health said there are ample testing supplies and anyone who wants a test, regardless of their symptoms, should feel free to get one if that's what you feel you need to do. Is that a reality today for residents of Snohomish County?
Okay. So taking those one at a time, the Secretary Weisman's directive to skilled nursing facilities and assisted living facilities that have memory care units to conduct testing of all residents and staff members who have not been tested since April 1 stands, and the target completion for that date for that is June 12th. The responsible parties for that are the skilled nursing facilities and those memory care units. And so the health district is available to provide technical consultation, facilitate that sort of thing. But the answer to that question really lies in the hands of the skilled nursing facilities themselves and the secretary who ordered them to do so. So the health district is a facilitator, technical assistant in that. Certainly our hope is that they meet that either in the letter or at least in the spirit and get it done quickly. Whether it's the 12th or the 14th or the 15th, I'm not sure that matters so much, but getting it done now makes a lot of sense, and that's why the secretary directed them to do so. Part two, availability of testing. Yes, certainly, again, our top priority for testing is if you're out there and you have any of those COVID symptoms, anything from a sore throat, runny nose, cough, fever, lose your sense of taste or smell, have headaches or vomiting, diarrhea, any of those symptoms that aren't explained by something else, promptly we urge you to get tested as quickly as possible for your own well-being, for that of the folks around you, and for that the whole county. And then testing for asymptomatic individuals, again targeted toward close contacts, particularly those who work in high-risk settings, outbreak settings. And then as that guidance that you're quoting mentions, anyone else who feels that a test is the right thing for them. And certainly, our efforts and emphasis again is on people who work in or visit or frequent high-risk settings where transmission is ongoing. So healthcare providers, first responders, emergency medical services, and other people working in settings like that. That being said, so if you have symptoms or you want to get tested, first stop is your regular source of healthcare to seek testing. If you're unable to secure it through that, or you don't have a regular healthcare provider, then you should go to the health district website, click on getting tested, and you should be able to find a test.
I think that wraps us up.
It does. This is Carrie in the Joint Information Center. Thank you all again for joining us this morning, and please do stay tuned for future media availabilities. Thank you.